Hello, my name is James Yu from Yale.
Roy Decker from Yale.
Dan Chamberlain from Banner MD Anderson.
And we're here to talk about our book, Pocket Guide to Radiation Oncology. I think we thought about making this book years ago when we were trying to study for the boards and make cheat sheets about the absolute clinical pearls that we needed to pass the boards. And so we decided to make this book. In making those summary sheets, we thought it would be incredibly useful, not only for studying for the boards, but for everybody in clinical practice because of the breadth of radiation.
Yeah, and we were initially thinking of it from a perspective of as a resident, but in a lot of centers, people have a specific disease site that they cover on a day-to-day basis, but then they have a colleague that's out of town, and they're supposed to cover a simulation for that person for another disease site, and they haven't done breast or prostate or what have you for several months, and we thought over several years if you're in certain academic situations or large groups where you're able to specialize. I know a lot of centers like my group, and I know the Yale group, have satellites that you go out to cover periodically where you transition from being a specialist to a generalist, and you need in a concise, handy resource to go to get your bearings on what you're going to do in that situation. And then if there's something more complex, you can go to one of the lengthier reference books. But just for the day-to-day coverage of your colleagues or other centers where you're not familiar with that disease site, we thought this would be a great application.
For the residents, I thought it was great to have, early residents and medical students frequently have really no structure on which to base, accumulating knowledge. And so this provides a very concise way of understanding how patients are managed, understanding, the basics of staging and treatment. So honestly, I think it's very helpful for their education, especially early in the process. And as Dan said, soon after we published it, I was actually called to cover one of our satellites and had to manage patients with, breast cancer and prostate cancer, things that I have not treated in many years. And I actually found it very helpful to look at those chapters that I had not written. So I think it's really an invaluable guide to provide really just the basics of patient management, workup, and evaluation.
Yeah, and there's a nice little literature section in the back, right?
Right. Dose limits for organs at risk.
I use that dose limits section probably more often than I should, but I do use it all the time.
I do too. We actually found after we provided it to our residents and our medical students that our nurses asked for copies. It's got some useful information on managing side effects. And also just understanding the overall process that the patients were going to turned out to be very helpful. Our PAs use it, and when we train new PA students, they actually get a lot of help out of it. So it's really been a great resource for a lot of different people.
Yeah, I've actually heard some feedback from dosimetrists that sometimes the communication between the attending physician and the dosimetrist isn't always as complete as a dosimetrist would like, and they've gone to that book in order to kind of figure out what they think that attending physician is going after, and then they use that to cycle back to the attending and check and say, is this what you were looking for? And it just helps them with their workflow to have a better idea of what on a standard case an attending might be looking at.